We'll start off with remarks from each of us and then open the phone lines to questions from the media. We'll begin with Dr. Tilson.
Good afternoon. First, as of this morning, there were 137 cases in North Carolina in 38 counties. As you know, we have now confirmed community transmission. This means we have cases where we don't know how people contracted COVID-19. I'm going to take a moment to reiterate some of the things that Secretary Cohen shared yesterday. Confirmation of community transmission means that we are beginning to transition from containment to mitigation so that we can flatten the curve so that fewer people get sick at the same time and we don't overwhelm our healthcare system. As Secretary Cohen shared yesterday, we've already been taking actions as if we've had community spread to get ahead of the virus. As we move into this next phase, we need to continue to reduce the chances for further spread and exposure and protect our healthcare system so it's there when people need it. People are a key resource. Our doctors, our nurses, janitors, transporters, respiratory therapists, and many, many more who work in healthcare, and they need to have supplies like masks and gowns and gloves to keep themselves safe and healthy as they care for those who have more serious medical needs. Today, we also sent a letter to every doctor in the state to recruit volunteers to supplement our healthcare workforce. We are already seeing hospitals stopping elective surgeries, and more of that will be needed. We put out new guidance to hospitals today. Testing for people with illness will also become less important as we transition to this next phase. We will begin to deploy other surveillance methods to understand the spread of the virus across the state and help inform our decision making. And more importantly, we want to reduce the chances that people will be exposed to viruses or expose others. I know this is a challenging time, but it is important to remember that the vast majority of people who get COVID-19 will have mild illness and will recover at home. Thank you. Turn it to.
Thank you, Dr. Tilson. And now we'll go to Chief Deputy Secretary Susan Gale Perry. Ma'am, you have the floor.
Thank you, Director Spryberry. As you know, when Governor Cooper ordered public schools to close, he also created the COVID-19 Education and Nutrition Working Group to ensure the health, safety, educational needs, and well-being of children during school or child care closure. Within hours of the governor's announcement, a joint North Carolina Department of Health and Human Services and Department of Public Instruction team jumped into action. And yesterday, a 26-member working group that included representatives across early learning and public school associations convened to discuss progress and next steps. This is truly a collaborative effort. We know for many children and families that schools and child care programs are more than places to learn. Many children rely on them for their meals for the day. Ensuring children have enough to eat was our top priority. As a first step, we submitted numerous waivers so that our communities would be able to meet this need and have received approval on some from the U.S. Department of Agriculture and are awaiting still approvals for others. As of today, all 115 public school districts, many working with community partners such as food banks and large faith-based entities, have approved plans to serve meals to children. Most school districts have already begun providing meals to children. As of today, 973 sites are providing 375,000 meals daily. I want to stress that all children in the family who come to the sites will receive meals. They don't have to be just school-aged. And we have prioritized putting these sites in economically disadvantaged areas. Many sites are also serving as nutrition hubs where families can pick up additional food that has been donated. I especially now want to recognize Dr. Lynn Harvey, the Director of School Nutrition and District Operations for the Department of Public Instruction, who has worked tirelessly to request waivers and provide guidance and support to districts in standing up these school feeding sites, and to Dr. Kelly Kimple from DHHS, who has worked side by side with her. We're also providing support to our child care workforce. Many child care programs are weighing the decision to stay open or to close programs in response to the COVID-19 outbreak and school closures. We know these are hard decisions. The fact is that some families really need our child care community now. We're standing up a new network to connect those working to keep our community safe and healthy, like first responders, emergency management staff, hospital staff, frontline healthcare workers, nursing and adult group home staff, child care program staff themselves, and food service staff, among others, to child care options that they need. At the same time, we know that child care teachers need to take care of their own families and the families and children that they are serving. We're working hard to give child care programs the best guidance we can on how to stay healthy and protect themselves and others. We've sent all child care programs, and it's on our website as well, guidance on several issues to support them if they remain open. We've also created guidance so that schools could serve as emergency child care providers for school-age children during the COVID-19 school closure. Our child care workforce has always been the bedrock of our state's economy, both allowing parents to work to support their families and creating the foundation for learning for our youngest children so that we have a strong workforce for tomorrow, and we need them now more than ever. We are immensely grateful to our child care and school partners who have risen to the challenge of serving our children and families during this challenging time. Thank you very much.
And thank you, ma'am, for all of your hard work on child care and all the great people that help. So again, my name's Mike Sprayberry. I'm the director of the North Carolina Division of Emergency Management. The State Emergency Operations Center is in day 11 of our active operations due to COVID-19 and remains activated at a level 3, with North Carolina Department of Health and Human Services serving as the technical lead and with support from a variety of other state agencies. We're also conducting health screening of everyone who enters the building, and we have hired extra housekeeping staff who are working hard to keep the facility clean and sanitized in order to help protect the health and safety of everyone working here. I know there's lots of questions about additional measures that might be in our future. Right now, we're not issuing a shelter-in-place order or additional closure of businesses. This is an evolving situation, and any changes will be based on what's happening in North Carolina and what's best for public health. We're making plans to activate a small number of our National Guard soldiers who will serve in a logistical capacity, helping with warehousing and transportation of supplies and equipment. We continue to see food staples being bought up quickly as grocery stores can restock their shelves. Please resist the urge to buy in excess. Grocery stores will remain open, and there is not a food shortage. There's adequate material in the supply chain to our grocers. Stores will be able to catch up and keep shelves stocked if everyone limits purchases to what they need, and if buying in excessive quantities is avoided. North Carolina 211 remains available as a resource for people to call assistance related to the COVID-19 coronavirus. People with questions about COVID-19 can dial 211, and based on the nature of their question, they'll be routed appropriately to get an answer. 211 can help people with needs like food assistance, support for families, and other basic needs. If you want to stay up to date on COVID-19, you can also receive information by text. Just text COVID-19 to 898-211 to get regular information updates via text. More than 20,000 people are already signed up and receiving regular test updates from 211. I want to remind everyone of the importance of getting information about the COVID-19 coronavirus from reliable sources like the CDC, the Department of Health and Human Services, and your local health department. There's a lot of bad information out there, especially on social media. Make sure you choose reliable news sources and consider the source of information you receive. Thank you so much, and at this time, we'll take some questions.
This conference is now in question and answer mode. To alert the speaker that you have a question, 110 pro. questions remaining.
Hi, this is Melissa Boughton from NC Policy Watch. I don't know if there's anyone there who can speak to this or not, but there's been some confusion over evictions and what counties should or shouldn't be doing with regard to evictions. Is there anyone there today who can speak to that?
Evictions.
This is Dr. Elizabeth Tilson. That is on our radar as something that we need to be thinking about, but part of some of the information you can get through 211 in thinking through some of those social service providers.
You have 11 questions remaining.
Hey, this is Randall at WREL. I wonder if we have an update on the current patients that we have, how many are in the hospital, and as a follow-up, we have been contacted by several workers, especially in grocery stores, who would like to wear face masks as a precaution, but they're told by their bosses they cannot. What advice can you give to them? Thanks.
This is Dr. Tilson. On your first question, in terms of the status of our people, of our total cases, we are aware of 4 hospitalizations amongst those cases. For your second question, as we've been saying, wearing a face mask as prevention if you are not sick is not recommended. If you do have respiratory symptoms, that is when we're recommending using a face mask.
You have 10.
Hi, I'm Alex Shabbat with WCNC Charlotte. I know you said that shelter in place is not a reality right now, but how close is it to possibly being a reality, and should people be preparing for that? My second question is just how prevalent are issues of testing where people are unable to get testing right now? What are you hearing with that?
So I'll take the first question about shelter in place, and then for testing, I'll ask Dr. Tilson to consider answering that one. And so with shelter in place, as you might imagine, we are watching the rest of the nation and what they're doing. Currently in North Carolina, there's no plans for shelter in place. But as you know, this situation is constantly evolving. So, but again, there's currently no plans for shelter in place. Dr. Tilson?
Thank you, Director Sprayberry. We have been increasing access to testing, and we know of at least more than 3,000 tests have been done across the state, so we have been able to increase access to tests. However, as I said earlier in my remarks, as we move through this response, testing, especially those with mild illness, will become less important as we move through our response.
You have 9 questions remaining.
Hi, this is Carly Brousseau from the News and Observer. I have a question about nursing homes and assisted living facilities. Have there been any positive tests at those, among people who live at those facilities?
To my knowledge, there has not been. This is Dr. Tilson.
You have 9.
Good afternoon. This is Elena Athens from ABC 11. I have 2 questions, and I believe Dr. Tilson might be able to answer both of them. First, if you could talk about the uncertainty that warmer weather could kill off whatever is circulating in the air. You know, we're experiencing beautiful weather today. There are a lot of people out enjoying it, and some might be apt to let their guard down in that process with the thought that, you know, the warmer temps could kill off what's in the air. So that's my first question. And second, we hear a lot about the tests that have come back positive. Can you speak to those that have come back negative? Is there a ratio or percentage?
I'll tackle the first one first. For our regularly circulating viruses, we do see a seasonality. That's why we call it the cold and flu season. So remember that we have 4 coronaviruses that circulate all the time. Also, flu circulates all the time. So we do see that again, the cold and flu season is when it's cold, and then as it gets better, warmer, we see a decrease in the circulation of those commonly circulating viruses. However, because this is a novel virus and nobody has that immunity, then it's uncertain as to if the warm weather will have that much of an influence on the circulation. So we are, we'll have to wait and see on that one, but I'm not sure that we can apply what we know in our regularly circulating viruses to this novel virus. And
you have 8 questions remaining.
there was a second question, and I apologize, I can't remember what it was.
With Spectrum News. Oh, sorry about that. I've talked to a couple of family physicians who say they're still having trouble getting their orders fulfilled of personal protective equipment and trying to get some of those COVID-19 testing kits. Can you update us on efforts to get that vital equipment to those physicians, and has the run on grocery stores impacted the ability to get that equipment where it needs to go?
So this is Mike Sprayberry. Let me understand the question. Did you say families or did you say medical facilities? I mean, who's trying to get the PPE?
I was referring to family physicians, so medical doctors.
Okay, sorry. Got it. So I will tell you that, I'm sure that you know, there is a nationwide shortage on personal protective equipment. We actually have 15 critical items that we've listed. We are working very hard to find and buy those items because right now we're looking at this as we want to make sure that we buy as much as we can to have as much as we need for a long-term event. And as far as a local physician, I can only assume they're having the same types of difficulties that we are in finding that personal protective equipment. As you know, every state in the country is experiencing the spread of this virus. Some it's worse than others, and so everybody's trying to buy the same thing at the same time. So we're all working hard to get through it. So that's kind of where we are right now.
Hi, my name is Kate Martin, and I'm with Carolina Public Press. I have a question about the people who have tested positive for COVID-19 who are not residents of North Carolina. How many of those people have tested positive for COVID-19, and in which counties are they currently?
So the question is the patients who are not North Carolina residents. That we are tracking those who are positive in North Carolina, and that more detail on some of those informations, our communications team can reach back out to you to give you some more detail on that. And then I remember the other question that the reporter asked that I apologize was of all the negatives, and that's what we said. So remember, we have had more than 3,200 completed tests, and then we have the total positive 137. We know that denominator of all the tests is incomplete because those tests are being done by state lab as well as other commercial labs, but that can give you a little bit of a sense of the ratio of positive over total tests.
Yeah, this is Travis Fain with WRL. Dr. Tilson, could you go into more detail as to why testing will not be as important in the next stage, and also when about that stage hits us?
Yeah, as we think through the phases of an outbreak and we move more towards community mitigation strategies, really thinking about what we can do at that population level to decrease the risk of exposure, then testing, especially those of mild illness, is not as important as we move to those more community mitigation strategies. One of the reasons testing in the beginning is important to start understanding the spread of the disease, but we will be putting into place other surveillance strategies in order to understand the spread of the disease.
I'm not sure I understand.
Hi, this is Emily Weaver from the Daily Record. Forgive me, please, if you've answered this question like 100 times already. But we have a lot of readers who, keep asking us, what is it about this virus that is made our reaction to it different than, others in the past, like Zika, H1N1, SARS, and all that. And also, I wanted to ask again for a clarification on what the National Guard will be doing here in North Carolina. Thanks.
So I'll go ahead and get the National Guard question out of the way. They're going to be working on logistics and transportation as we get personal protective in. They'll receive it, inspect it, and then make distribution of it. So that's how our National Guard partners will be working with us. And for the other question, I'll turn it over to Dr. Tilson.
So, again, this is a novel virus, but you are right. We've seen several other novel viruses throughout the past 10 or 20 years. H1N1, of course, was a novel influenza virus. This is a family of viruses called coronaviruses. And so you're right, SARS and MERS were other novel coronaviruses. There are 7 different coronaviruses that we know about that infect humans. 4 are the commonly circulating ones that we're used to, and people have already built up immunity to. SARS and MERS were novel ones that didn't have immunity, and then this is now our newest novel coronavirus. And that part of the reason of the spread is that nobody has that immunity because we haven't seen it before.
Sam Walker with obxtoday.com. The question for both of you regarding, you've got 3 major metropolitan areas for North Carolina bordering in one in the opposite corners of the state. Hampton Roads, which borders our area, Wilmington in South Carolina, the Myrtle Beach area, and then Charlotte, of course, South Carolina. How much coordination is going on between yourselves and your counterparts in those 2 states with regards to how each area is responding to this? Thanks.
So I'll go first. I can tell you that I'm in close contact with the directors of each of those states. For instance, when we had a small business administration disaster declaration this week, which declared for all 100 counties in North Carolina, it also causes all adjacent contiguous counties in the adjacent states to have a disaster declaration. So I personally reached out to them, provided them with a copy of the disaster declaration, and basically provided a synopsis of what types of disaster program benefits that it provided. We also talk about personal protective equipment, and we've even been coordinating when we can find a large cache of equipment. We talk about, okay, we can't afford one state to buy a huge amount. Let's figure out how we can split it up and make a purchase together as a team. So we do coordinate daily, and we're also on a conference call daily with our HHS and FEMA partners. Dr. Tilson?
Thank you. I'd say the same is true with our public health and our epidemiologists. We do a lot of coordinating calls, not just our neighboring states, but nationally as well, understanding what people are doing, understanding the guidance, understanding what they are seeing. So we are doing a fair amount of coordination and conversation with our neighboring as well as other states.
Hello, this is Daniel Walton with the Mountain Express in Asheville. Dr. Tilson, I'm curious if you can tell me more about these other surveillance strategies that the state will be deploying as an alternative to testing as the disease spreads.
And we're still working on exactly what that would look like, but we do have a statewide flu surveillance strategy. That's how we monitor the spread of flu across the state. And so we are looking at how we might be able to modify that flu surveillance strategy to have it be applicable for COVID-19. And we're working with the CDC as well and thinking through what could be our surveillance strategy.
Garrett Bergquist again with Spectrum News. Getting back to that request for volunteers, can you give us some more specifics on what specifically you're looking for, what those volunteers will be doing, and then have you gotten any responses to that so far?
Specifically volunteers for our healthcare workforce, understand who's that volunteer, understanding who would be willing volunteer, what their skill set are, and having them so that we could deploy them as needed. And let me give out the website if anybody who does want to volunteer. The website is www.volunteernc.org, and you can click on disaster.
Hi, this is Julie from the Carolina Journal. I was wanting to ask about the R0 that you guys are working with. The World Health Organization had estimated around 2 to 2.5, but I've heard it could go as high as 4. When you try to limit community spread, sort of what number are you working with that you're expecting?
Yeah, so the R0, which is if one person isn't infected, how many other people would they infect? What we're trying to do is with all of these community mitigation strategies and social distance strategy, that's exactly what we're trying to do. We're trying to lower that R0. We're trying to lower, if one person is infected, how many other people will they get infected? And so you'll see different modelings with the intensity of the community mitigation and social distancing, how you can decrease that R0. What I have seen is an R0 around 2.5, but again, we're still learning. But what we want to do is lower that R0 as much as possible and limit the amount of people an infected person might be able to infect.
Hi, this is Sarah Ovaska from NC Health News. I have 2 questions. First, I've seen in other places some discussions about having more innovative approaches to protective equipment. Have there been any discussions with various manufacturers or academic centers or tech resources here in the state in order to see if there's a way that we could make some of these on our own? And also, I'm curious about, and as a second question, I'm curious about whether there is any knowledge if there's any treatments that are experimentally being used on patients in North Carolina. I know that there's been discussion of the malarial drugs being used in other places, and I'm wondering if we have knowledge if that's being used at all in North Carolina.
Take the first question about the possibility of North Carolina manufacturers making our own personal protective equipment. We have been in several discussions about that as recently as today, and to determine what it would look like to try to begin building with some of the factories that we have here and shifting from making other products into products like N95 mask and things like that. So yes, ma'am, we are in those discussions right now. And for the drugs, I'll turn that over to Dr. Tilson.
So to my knowledge, we are not doing any clinical trials in North Carolina, but that has been something high on our radar, and we're going to be reaching out to our academic partners to understand if anybody's doing that or if there's any interest in a clinical trial in some of the pharmaceuticals.
Hi, this is Jonathan Drew from the Associated Press. I have a question for Dr. Tilson. Can you tell me how many drive-through centers there are in North Carolina and whether a doctor's order or appointment is needed?
I can't tell you the exact number because most of these alternative sample collection sites are being done, a lot through our private partnerships, a lot through a healthcare system, and they are being done through a referral from the provider.
Is the doctor's order appointment needed?
I think there's probably different referral patterns that each of these networks have set up. I'm not sure that it's a one-size-fits-all, but it is really being done in partnership with the provider's office.
Hi, this is Steve Wiseman from the News and Observer. This question is for Dr. Tilson. Are you going to be releasing numbers over the weekend on the website of cases and hopefully no deaths? But is that going to be going on Saturday and Sunday as well?
Trouble hearing you, but I think the question was, will we be updating our numbers on the website over the weekend? And the answer to that is yes.
Okay. And have you had any more positive tests tied to community spread today? I know we had one yesterday. Is that something you're still tracking?
We've had two people that we think are community spread.
Okay. And my last question is in regards to Durham. There's been a lot of cases there lately that I think that county has more in the state now than any other county. Do you know why Durham has been hit so hard? Is it Duke students that traveled? Is there any other reason you can think of?
Yeah, there was what we do see with this coronavirus, that seems to be these clusters. So with flu, often we see a consistent spread across the state. With this, we see there are more clusters, and so there is a fairly big cluster of people who had returned from foreign travel. That might be driving some of the Duke's numbers. Durham's
numbers.
Good deal. Thank you.
Yeah, you're welcome.
Thank you, everyone, for your questions.